There are three types of polio. Non-paralytic does not lead to paralysis. Spinal paralytic, which can result in paralysis of one or more limbs. Bulbar can result in dysfunction of swallowing mechanisms, respiratory embarrassment, or circulatory distress. June 17, 1894, the first U.S. polio epidemic. The first major documented polio outbreak in the United States occurred in Rutland County, Vermont. 18 deaths and 132 cases of permanent paralysis were reported. 1928, the iron lung. Philip Drinker and Charles Mackin at a children's hospital published a paper describing successful use of an artificial respirator for patients suffering from paralytic polio. The machine, first known as Drinker's respirator and was later known as the iron lung, would provide temporary and in some cases permanent breathing support for people suffering paralysis of the diaphragm and intercostal muscles, which are essential for respiration. The Drinker respirator was a sealed tube-like structure powered by electricity. The patient's head extended from the tube, and the body, with a rubber seal on the neck, was entirely closed by the tube. Decreasing pressure forced the air in the lungs, and increased pressure forced air out. The most extensive outbreak occurred in the first half of the 1900s, until polio vaccination was introduced in 1955.
In 95% of polio cases, there are no symptoms. A small number of people may have fever, sore throat, headache, nausea, vomiting, abdomen pain, or diarrhea. 1 in 200 infections lead to irreversible paralysis, usually of the legs. Among these paralyzed, 5 to 10% of patients pass away when breathing muscles become immobilized. Polio can infect a person of any age, but children 5 and under are especially vulnerable and make up roughly 50% of polio victims. Because there is no cure for polio, the best protection is prevention by way of vaccination. Until every child has been vaccinated, their polio virus will be alive. There are 4 types of polio vaccinations, and if a child is vaccinated multiple times, they may be protected for life. The virus is found in saliva and feces of sick people. It can be spread by direct contact with a sick person or through the air when a sick person talks, coughs, or sneezes. It is also spread by food, water, or hands contaminated by the infected feces. Polio cases have decreased more than 99% since 1988, from an estimated 350,000 cases to 223 cases in 2012. The reduction is the result of a global effort to eradicate the disease. As of 2012, 5 countries remain infected with the virus, including Afghanistan, Chad, Nigeria, Pakistan, and Nigeria.
Play that funky music, white girl. Now, now. Play that funky music, white girl. No.